Okay, so our next question is, at the age of 66, I'm worried about undergoing sedation for a tooth extraction due to my dental anxiety. Additionally, I have concerns about numbing agents because I had a severe reaction to an epidural during a C-section 40 years ago and was advised to avoid medications from the same cane drug family. As a result, I've been avoiding dental visits. However, I recently had some dental work done, and my dentist is quite cautious and tries to keep me relaxed. We've discussed whether it might have been something else in the medication that caused my reaction, but my fear remains quite high. Is it possible to have a tooth extracted while being administered only Ativan and not recalling the procedure?
Well, there are multiple parts in this question here, so I'm going to try and see whether I can simplify the question here. So, this follower is concerned about being sedated for the procedure because she has some fears about the undergoing sedation for tooth extraction procedure. And the second, she also has some allergic reaction from one of the drugs being used for numbing the tooth. So we call it Novocaine or lidocaine or articaine. That's what she called it, as a cane family. Novocaine, we don't use it anymore, but I just mentioned it because that's, you guys probably know as Novocaine. So she's concerned about using the Novocaine because of the allergic reaction. So, and she also asked about the third part of the question, whether she can take an Ativan, which is like an anti-anxiety pill, or an anxiety pill, just like going to your doctor and then taking a Valium just before you go to sleep, right, to kind of calm you down. So what she's asking, whether she can take the Ativan, whether it is going to help her calm down. So going to the third part of the question, so can you take an Ativan to calm you down? Absolutely you can. Is that going to help you relax? It is going to help you relax. And is that going to calm you down? Yes, it is going to calm you down. Is that going to help you not remember the procedure? Most likely yes. You are going to have some kind of an amnesia following taking the Ativan. All of these could happen. And to answer the second part of the question, which is, if you are allergic to the cane family, what other options do we have? So if we are taking Ativan, and possibly can we numb the tooth, like a lot of times when patients have a true allergic reaction to the cane family, we can do the procedure sometime with Benadryl. Depending on the procedure, we inject the Benadryl into onto your tooth, and then if we are able to get enough anesthesia, we are able to do the procedure just with Benadryl. Or very rarely, is it truly absolutely necessary for you to have any type of anesthesia or local anesthesia on the tooth? Can you do it without, depending on, like, if it is a small filling, can you tolerate that without having any anesthesia possible? It can be done. Or the other thing is it a true allergic reaction? If you had this reaction long time ago, my recommendation is to go see an allergy specialist and then do some allergy testing to see whether you have true allergy. And if you do not, then you don't have to worry about like shying away from the dentist anymore. My recommendation is absolutely go see an allergy specialist, and then they can do some allergy testing, so you don't have to worry about that. And then the third part of your question is, do you need to be worrying about being put to sleep? Well, of course, people have fear about being put to sleep. If you're going to take Ativan, which is very similar to doing like a moderate sedation with IV sedation, it's no different. So if you don't have any fear about taking an Ativan, you should not be fearing about the moderate IV sedation as well. So nowadays it's very safe for you to be doing IV sedation. And a lot of times, like I said earlier, and what we mean by conscious sedation is, hey Lynn, wake up during the procedure, and she's going to wake up. Hey Lynn, open your mouth, and she's going to open the mouth. And hey Lynn, take a deep breath, and she's going to take a deep breath. So you're going to be totally conscious, and the goal of the sedation is to calm you down, bring your anxiety down, and yet you're going to be conscious, and you're going to be on the twilight sedation. and you're going to be in the la la land, like we say in our office. Okay, so definitely I wish you good luck, and you can talk to your dentist about your options.
Wonderful.